The CDC's decision to significantly reduce the number of vaccines recommended for all children marks one of the biggest changes to childhood immunization guidance in decades. 25 News Now weekend anchor Amaya Norman tells us what this all actually means for parents here in the Crossroads.
This week, the Center for Disease Control and Prevention made a huge move, changing the vaccine schedule that has long guided childhood immunizations across the country. Previously, vaccines protecting against 17 different diseases were universally recommended for all children. Under the updated guidance, that number drops to 11. 6 vaccines are no longer recommended for all children and are now advised only for certain high-risk groups or through shared decisions making between parents and healthcare providers. Those changes could impact vaccines that protects against illnesses like the flu, rotavirus, and bacterial meningitis, among others. We spoke with David Gonzalez at the Victoria County Public Health Department about what this could mean locally.
We're looking at doing, and any time you pull back on recommendations for vaccines, yeah, there's definitely a risk for any vaccine and any illness and disease, a risk of those rates going up with disease when you're removing those vaccines from the schedule. And flu is one for sure. We see right now we're in the middle of flu season. If you have decreased flu vaccination rates, you're going to have an increase in disease and an increase in severe illness and disease, and that's what we're seeing right now. We saw it during COVID. If you think back then, before we had COVID vaccines, high risk of occurrence of disease, you had high occurrence of severe illness, and then once the vaccine started making its way through the population, you had less risk of increase in severe disease. And
Gonzalez says at this time, no immediate changes are being made in Victoria County, noting the recommendations are still very new, but he warns reducing vaccination could increase the risk of disease spread in the community. And health officials encourage parents with questions to talk directly with their child's medical provider. They can also contact the Victoria County Public Health Department for more information. Public health leaders say they will continue to monitor guidance from the CDC as more details are released. Don.